we are sure you will do whatever is possible to support Nma. The team is very apt, and we are indeed very happy we have started discussing this. Just today, me and the CMAC, we just came from seeing a patient. We admitted a patient who happens to be my cousin with no place for admission. Why? Because the facilities were stretched. Therefore, we need to support, we need to revitalize the primary health centers so that we can reduce the burden from Udut and other tertiary institutions. Right now, our institution functions both as primary, secondary, and tertiary. We have derailed from our main objective. So we are indeed very much happy we are having this discussion, and whatever we will do as an institution to support this idea, and Dr. Nare, whatever Udut can do to support you, we are willing to do that. Whether with personnel, whether with equipment, whatever we do, please bring a proposal wherever we need. It's to our own advantage, it's to your own advantage. But we are indeed very happy and we support this initiative. We thank you very much. The Nma Sokoto, we support you, we have been part of you, and the presenters, you have done excellently well. Dr. Vic, I work closely with him, I was his secretary, and we know what he can do, and he has delivered excellently well. We also are happy with Dr. Shamsu. Is he still around? Yes, for what he has done, and this is not the first time. He's very passionate about this thing, and we are very happy about it. Dr. Nare, we are happy, and we will support what you are doing. Thank you very much, and God bless.
Deputy Vice Chancellor, Research and Vision Development. My responsibility is to commend and congratulate the Nigerian Medical Association Sokoto for putting this together. It has been traditional for Nma Sokoto, for other academicians to have scientific conference. Each time we see that we're having a gathering of academics making presentation of their findings, we are always elated. So we congratulate you and commend you for this scientific conclusion. We encourage that this should be an annual ritual so that we are able to disseminate the findings of what we do within our hospital. Also, let me tell all of the issues that are present here today, especially our keynote address speaker, the person of Professor who happens to be our teacher. Thank you for your thought-provoking presentation and all the other speakers that have spoken today. At this juncture, once again, I commend and congratulate the leadership of Nma Sokoto. Thank you, Lord.
Thank you. I'd like to also stand on the existing well-established protocol on behalf of the NOC President MD Khan. I would like to congratulate Nma Sokoto branch for this wonderful conference that has been organized. I want to thank all the invited guests and the keynote speaker for a well-delivered topic. So I congratulate Nma Sokoto once again for this beautiful conference. Congratulations. Thank you.
Thank you very much. I'd also like to invite the NAMDA President, Sokoto chapter, in person of Professor Usman Bello. Please say the word of you.
Thank you, Mr. Vice Chairman Nma, the chairman of the occasion, permit me to stand on the existing protocol, but I recognize my Vice Chancellor and my Provost and my CMDs for their continuous support, especially to medical academics. The Nma team is apt. We have heard all the speakers. The speakers have spoken very well, and we have gotten some results immediately now. The CMD has promised the head of the primary healthcare agencies in the state to collaborate. So we have started getting the result of this conference. Even if we stay here from today at least we have achieved something. So this is commendable. I congratulate Nma for this gesture. I want to assure our continuous support to the Nma, and also in this direction, for us the medical teachers, we are also promising you, inshallah, uninterrupted release of medical doctors continuously without any hitch. Thank you very much.
So the representative of the CMD, Federal Nma Sokoto of the Korean, who was also here with us to give us a word of one or two goodwill message.
Invited guests, other members of the high table, ladies and gentlemen, good afternoon. I am Dr. Abdulaziz Hadi Ibrahim, and I have the honor to represent the Acting Medical Director of Federal Nma Sokoto Hospital, Korea. He actually intended to be in this program. However, due to unavoidable official engagements, he was unable to be present in person. However, he asked me to convey his appreciation over the invitation to participate in this program organized by Nma. And he also asked me to convey the message that this topic of universal healthcare coverage is very timely, and also congratulating Nma for organizing it at such a period in time. So thank you very much for inviting us. Thank you very much to the presenters. Thank you.
So, heavily represented by one of our own, Mr. Bello. Please say a word or two.
Good afternoon all. With due respect, follow the due protocol. Dr. Bello A. Muhammad, the Medical Director of Federal Medical Center, Gusau, is unavoidably absent here. He just asked me to say a few words on behalf of him. Just to extend his felicitation, and he rejoiced with Nigerian Medical Association, Sokoto State Chapter, for successfully conducting the annual general meeting and scientific conference of 2025. He reiterated his commitment and dedication to continue to support the NMA, and he really considered himself as a member of Sokoto State NMA. So just to rejoice and extend that on behalf of himself and his hospital, he sincerely appreciates the invitation, and he's not turning down the invitation because he asked somebody to represent him, and he actually shows his continued support for it. For the lecture, actually, we are well informed. It cannot be better than this, and we have really seen the magnitude of the issue. Just as Professor Anders mentioned, many a times patient will go to special hostel, no bed space is full. He comes to teaching hostel, no also bed space. Many patients are stranded, where to go? When ordinarily some patients who are not supposed to be managed in the teaching hostel are there. You see simple malaria straight to the teaching hospital. You see like uncomplicated UTI, all this one going straight to the teaching hospital. When this patient should be primarily managed in the primary health care setting. But because we are quite grossly underutilizing it for so many reasons that are mentioned during the 3 lectures, we really need urgent intervention regarding this. So thank you very much.
So I walk in the Honorable Commissioner of Health, Dr. Farouk Umar Abubakar, who is ably representing His Excellency the Executive Governor of Sokoto State, is just arrived. The next for the good message is the Vice Chancellor Usman Motor University, heavily represented by the TVC Research and Innovation, Professor Tuf.
Let me also stand on the existing protocol. Let me recognize the Executive Governor, Sokoto State, ably represented by the Honorable Commissioner, the Chairman of the occasion, His Eminent Sultan of Sokoto, ably represented by the Sultan of other members of the High Table. It is my honor representing the Vice Chancellor. It's very important occasion of the annual general meeting of the Nigerian Medical Association Sokoto State Chapter. Let me begin by thanking the organizers for inviting the Vice Chancellor and the guest of honor this very important occasion. And let me also commend the Nigerian Medical Association Sokoto State Chapter for maintaining this tradition, this culture of annual general meeting. It is an occasion which affords the members an opportunity to interact. Universal health coverage means simply providing healthcare services to everybody at no cost. Honestly, looking at our society, looking at our challenges, looking at our limitations, it's not an easy task. It requires all hands on deck. It requires commitment. It requires innovation. It requires a lot of collaboration. And it is our hope that during this your meeting, you will look at all options. Particularly, but not limited to issue of manpower development, issue of infrastructure, digital medicine, like one of the speakers mentioned, innovations, maybe public-private partnership as some of the possible things that will ensure the realization of the goal. And looking at the caliber of participants, I have no doubt that at the end of your annual meeting, something good, universal healthcare coverage. In addition to our mandate of teaching, training of health professionals, we are also involved in research, especially targeting local health challenges. We are all aware of what is going on in Cameroon and also at research centers of the university. We will continue to do our best. Our university is key in the government efforts of addressing challenges of especially doctors in the country. We've been selected as one of the universities that receive high impact intervention by the 10th one. 4 billion, and the university is invested. All this will be done in the College of Excellence. laboratory space, the more it is. And I'm sure the provost will attest to this. Let me at this stage commend our staff, the College of Essence, our consultants in the teaching hospitals, to endure for you. And we urge you to continue. As university will continue to support. Let me also commend the cooperation between the Nigerian Medical Association, the Usman Danfodio Teaching Hospital, and the Usman Danfodio University in strengthening medical training, medical education, including residency training. This cooperation must be sustained because it is needed to produce the needed workforce that will ensure the realization of these global universal health coverage we are thinking of. Because without the workforce, it is not going to work. So, on this note, I want to use this opportunity wish you successful annual general meeting. And I wish you all the best. Thank you and God bless.
Thank you very much, Vice Chancellor of the University for all the things that the university community is doing to support and improve manpower. Many including the new clinical PhD program at the university, one of its kind, a lot to improve the health sector. Thank you so much. Thank you. We'd like to also invite David to serve as Dr. Sefa Emana, President General, Nigerian National Council on Islamic Affairs, heavily represented by the District Head of Bodinga and Father Agm Goodwill, to say his word.
The chairman of the occasion, the special guest of honor, highly respected professors and doctors within the convention, other invited guests, Assalamu alaikum wa rahmatullahi wa barakatuh. I'm directed by His Eminence to be also here to represent the Sultan Council to present the Sultan Council in this important annual general meeting of the Nigerian Medical Association. His Eminence is wishing you well, and also assuring that the traditional institution will keep hand together with this association, the Nigerian Medical Association, in serving the humanity. Thank you very much for inviting the Sultan Council to be with you. Thank you very much.
Thank you very much. Finally, please permit me, let me invite him, His Excellency, Executive Governor of Sokoto State, Dr. Mohammed Ali FCNN, PhD, People's Governor, is ably represented by the Honorable Commissioner of Health, the former digital registrar, Nursing Council, who is also our digital commissioner, and a champion of health, person of Dr. Farouk Umar Abubakar, PhD, to pay his keynote and declare the AGM office.
Thank you, Mr. MC. The chairman of the occasion, who is also the former provost of the college, the chief medical director of Sokoto University, the vice chancellor, ably represented by the DBC Research and Innovation, His Eminence, the Sultan of Sokoto, ably represented by the district head of Odega, the guest speaker, the former vice chancellor at Hikma University, Lorraine, the provost, College of Medicine of Sokoto University, the chairman, Nigerian Medical Association, Sokoto Council. Let me also recognize the executive secretary, Sokoto State Primary Healthcare Development Agency, Director of Medical Services, Sokoto Ministry of Health, other distinguished highly professionals that are here. Good afternoon. Let me first of all tender my apology for coming late. This is very important. It is just interrupted by other very high state engagement. In fact, I had just less than a kilometer to be here when I was diverted to go back to the government house and proceed to the airport to accompany the deputy governor to receive Her Excellency, the wife of the president. So, I accept my apology. I'm not here physically, but my spirit is here. So this is very important occasion. First of all, let me thank the God Almighty that make it possible to be here to witness these very important, the annual general meetings of one of the respected associations in this country. Let me also thank the leadership of the association for maintaining the high level of professionalism, not the association of other similar associations that were operating. NMA have been recognized as a profession led by the highly respectable and matured professionals at all levels. And everybody that interacts with NMA, you know you are dealing with professionals of high level of integrity, who always have the interests of their profession above any other factor. So once again, I want to thank the leadership and the entire members of the association. The annual meetings of this association, it come at right time with the choice of this team, the pathway to universal healthcare coverage, aligning the work for welfare, health system resilience, and innovation in the primary healthcare. Choosing this topic at this critical era, where the healthcare services is most needed at all levels, and there was the provisions of NMA, whose membership are highly knowledgeable and have the interest of patients always, will now create positive impact in order to improve the health status of the citizenry. Let me assure the association, government is so much committed to ensure that the healthcare service in the states have not matched and received the high level of attention. You all agree with me, the present administration recognizes health as one of the 9 foreign agenda, and we have, since the inception of the government, we have commenced a number of activities capable of transforming our primary health care services at all levels. Let me inform you that over 130 primary health care across the state have been revitalized under the impact project and other intervention of the state. These primary health care were also provided with relevant basic instruments and equipment so that we make it functional. At the same time, each of these primary health care or primary health centers will be provided with solar electricity as well as the borehole in order to have consistent water supply. With the enactment of policies of compulsory posting of all health professionals that were trained, sponsored by the state government, must work for a minimum of 2 years in the primary health in the rural areas will come to reality. I want to inform you that one of the next steps that is ahead of us is providing the needed manpower at all levels of healthcare delivery, including the primary health centers. So that when you have a functional primary health center, the major ground is manpower and the skilled manpower. We know we have shortage of medical doctors that we cannot meet the demands of all the 244 primary health centers. But relatively, we try to make available medical doctors to all the closest referral medical general hospitals so that we can be able to provide the needed attention of referral services from these primary health centers. I wish to inform you that before the end of this month, we are going to effect posting of these health professionals to all the 240 primary health centers across the state. And that has gone along in sustaining the universal health coverage, because whatever you do at the primary health center, whatever you do, if you cannot provide enough power, then you cannot achieve the primary universal health coverage. So with this I want to assure you, government is committed in sustaining effective and high level professionalism at all levels and provide effective healthcare delivery. His Excellency is so much committed to that. On the part of the welfare, I want to inform the association, government is now committed in maintaining and sustaining the payment of allowances of not only the medical doctor, all other health professionals that are working at all levels. Our government will continue to do what is required to ensure that our hospitals are also functional. With the award of the contract of 9 general hospitals that have been awarded, over 2.9 billion naira have been approved to the renovations of these 9 general hospitals. Solar power has also been included. Each of the hospitals renovated will also have the power, solar power provided in those general hospitals. Equally, additional solar power were also provided in all the 21 general hospitals across the state, just to make the environment conducive, functional, and effective. So with this view, I wish to assure you, the Ministry of Health and the state government remain committed in sustaining the health care delivery at all levels. On part of the manpower level training, we have also commenced the necessary documentation and processes to ensure that we have the MDC and approval to commence the internship program at Special Hospital. Last 2 weeks, I had a very good discussion with the registrar when I was in Abuja, and Goodwill are going to actualize that. Whatever the requirements, we are going to meet the requirement in order to ensure that we complement what the teachers are doing by providing the needed atmosphere, the needed environment to commence this internship. Other professional bodies are also in line with that. We have already gotten the radiographer registration approval to commence the internship. The process is also ongoing with the Pharmacy Council, Medical and Laboratory Science to get approval to commence the internship in that perspective, so that we'll be able to provide the complement and in all perspectives. Our signed MOU of allowing the consultant by the teaching hospital to visit our teaching hospital has come in, and I want to assure you we are going to sustain that. As I'm telling you here, the allowances for the payment of September is still waiting for the end of September. Right now it's awaiting at the end of September. So I will make sure that we're not waiting for the end of the month to go and looking for money to pay that allowances for the signing MOU, because it will not pay. The money is right now waiting for the CMB, the end of the month, so that we will pay all the doctors and the consultant he has sent. Because the whole idea, somebody deliver the service, pay him at the end of the month. You also motivate him to do more. So I want to assure you, all the consultants and senior register we have engaged with that MOU of sustainability and consistently maintaining that MOU. So our those services will be maintained at all levels. With this be remarked, I wish to declare these conference open and pray to God Almighty to guide this association and give you the best, so that we'll be able to give the best professional service to the state. Thank you very much.